Okay, we have a interesting case sent to us today. Patient looks like they're going to be losing tooth number 26, and we need to evaluate if we can do an immediate placement here or not. So the first thing I look at when I look at the scan is trying to evaluate, is this a good case for a OptiGuide? Because as you can see here, this case was scanned using the bite plate. And in closer inspection, you can see that what looks like to be restorations on all these front teeth. But then my question is, it looks like there may not be restorations on this premolar, that molar. And when I say restorations, I'm talking about full coverage restorations, and maybe this canine and that molar. So retrospectively, the classic guide, the bite plate, is a safe move here. Okay, but retrospectively, this may be a good case for OptiGuide. And the bigger reason I say this may be a good case for OptiGuide is I can see that we brought in CEREC data. So if we were able to bring in CEREC data, then more than likely we're able to get the registration and now we can make the OptiGuide. But again, in doing this, we don't want to end up having to scan the patient twice. So if there's ever any question, obviously it's best to go with the bite plate because you can still, even with the bite plate in the scan, you can order this as an OptiGuide. So to give you a see, you can see here how it nicely meshed together. So just a little food for thought on that aspect of this. So, to give you an idea of what we're looking at there. So now, let's take a look and evaluate number 26 for an immediate placement. My initial thought in this particular case is this is not a good case for immediate placement. First, we can see that, first let's say that there's great buccal plate here. Okay, we can clearly see it. We can see the tooth. More than likely, we're going to be able to get this tooth out pretty nicely. The bigger question is going to be is, can we place this implant and get stability? Now, many of us are comfortable with the grafting, so let's take that issue out of play here, and let's take a look at the space that we have here. So my first question is, one is we're engaging the cortical plate on the lingual, and right here we're already breaking through the cortical plate basically from top to bottom. Maybe not right here, but certainly from this level all the way down. So my question to us is going to be, can we place this implant, get stability, and then can we graft around it? So the grafting around it part is not overly difficult, although I'm not a real big fan of grafting, um, entire wall of an implant. But my bigger question is can we rely on just two threads, maybe even one thread right here, to gain stability for this case? So my initial reaction to this case is going to be that I'm not a big fan of immediate placement. I mean, we can look at a 3.0 implant, but even that, not much difference there. So unfortunately, I personally, given my skill level, at my particular skill level, I'm going to take a pass on it. I know many surgeons would take an attempt at this. If I were to take an attempt, I would go in knowing that there are some risks here. The risks, from my perspective, are this lingual cortical plate and totally not gaining stability. But if I were to go in and do this, I would likely go in at a little bit slightly different angle than planned here. Maybe like so. And what I would probably do is use just a 2 millimeter osteotomy and then try to use some ridge expanders to see if I can expand this area of the socket out, then drive the Nobel Active implant in to see if that would get in there. I'm just not overly comfortable with this case. And the next question is, can we go longer and get stability? Now suddenly, this looks a little bit better, but again, we still have, then we have this medullary space to deal with. I just, can we go shorter? And even shorter doesn't, just even shorter doesn't really make me feel all that comfortable. So I personally would take a pass on it. I'm not encouraging you to do so. I just think that this is a very difficult case, and we have to be prepared for the consequences that may happen if things don't go exactly right. But I would love to hear the final results on this. Thank you.